I'm Katie from the C4D Network. I work with Jackie as network coordinator, so bringing these kind of events together here and around the world. I'm also project managing a project with Stacey and Jackie in Tanzania on community education, and the Peace Project with the UNICEF HQ, where we've just been in Dakar and hearing about peace building and C4D in countries across sub-Saharan Africa, so that's been great. And yeah, thank you so much for your talk. After your very in-depth look into one country, we're now going to be shooting all over sub-Saharan Africa, and specifically focusing on HIV and AIDS response and adolescents, and the use of new and emerging ICTs. And I call this risking impact for innovation, because that seems to be a tension that's at the heart of these. So this was a study which we as the C4D Network did last year. It was delivered at a conference in Harare in November, and we did it in collaboration with our East Africa hub. Here's them at a meetup like ours, maybe not with Jackie's homemade rolls, in Nairobi last month.
Get a stew there.
Yeah, but so UNICEF commissioned the report, and it was to look at the use of new and emerging ICTs across sub-Saharan Africa through case studies, documenting the case studies and gathering together lessons learned. So we gathered 16 different case studies, which eventually turned into 11, which were really in-depth and had enough information. And from them, we gathered the lessons learned. We'd put a call out on the network, which we got some response to through email and speaking to people through Skype. But what really worked was having our hub in Nairobi, speaking to people, being in touch with the community there. So it's a great opportunity for the network to work well, and yeah, really flex its muscles. Because this is to go back to my first slide, this is a really key issue. Adolescents are particularly vulnerable to HIV and AIDS. 1 in 7 new infections, WHO thinks, is people aged 10 to 19, which means there's about just over 2 million people with HIV and AIDS aged 10 to 19 at the minute. But adolescents are also particularly capable, innovative, fast at learning new technologies. So maybe this is a golden opportunity, bringing the two together. But then there's this risk of innovation for impact. So here's what we found. So my presentation is going to go through, well, I've gone over how we did it, so now we'll see what we learned. We did have 10 key recommendations, but I'll bring them together into 3. And then, so what happens next? So our first lesson was people before platforms. And I think all C4D practitioners know, of course, we should do formative research and really know our target audience and people participating in our campaigns before we do them. But this is particularly important to remember using ICTs for a number of reasons. Because they're so new, they're exciting, you want to jump on this innovation, and surely it will fit with the young people you're working with because they're young and they like using phones, for example. But that's not the case. It's really important that people come before platforms. It's also important because ICTs, although we're bringing them together as a group, it's kind of false. They're so varied, and the nature of the interaction between the ICT and the user is really different from platform to platform. So it's really important to think about that first. And finally, the needs of the different groups within youth who suffer or who don't have HIV and AIDS are really varied. So we need to look at all those factors. A World Bank report, this was released last month, shows that internet use around the world, first of all, it's growing massively. Last year, over 3 billion people in the world were online, compared to 1 billion in 2005, so over 10 years it's tripled. But, and as you guys said in your presentation, its use of ICTs kind of disproportionately advantages young urban men, which you can see with these big 3 pillars here. This is great, because this is what we're working with. We're working with young people, so we're taking advantage of this bias. But these interventions aren't just working with urban people, and they're not just working with men. So I wanted to have a look at a few of the case studies which were working with these disadvantaged groups. So the first is this group. This is UNFPA's intervention in Nigeria, and hopefully I can try and show a bit of the clip later. It's got the fantastic name No Hoodie, No Honey, and it's 2 5-minute films which feature, there's 2 main characters, Ene and Toju. This is Toju, who's very sassy, sexy, knows the world, and she's funny, as you can see. And then there's a more inquiring, shy character, and they're just these two very simple, quite low quality, as you can see, videos. And they've been dispersed free online, and they're accessible via social media. And this response came from a very in-depth pre-project study into sexual health among adolescents. And it was found there was a real lack of knowledge, and women in particular weren't informed enough to make the right choices and didn't have this sort of self-confidence and the sense of their own voice to know what to do in kind of first sexual encounters or all sorts of different situations which these short films deal with. So this is an example of really honing in on a target audience, women, girls aged 15 to 24, and producing something that was popular for them. And thinking again of the urban-rural, they also produced this as a comic, so it wasn't just available as a film. As Jackie mentioned earlier, this is an intervention that we heard about in Dakar. It's not to do with HIV and AIDS, but I couldn't resist putting it in here because it's great. And it's working with rural people with mobile technology in Nigeria. Now it's interesting to hear the results of your study in Sierra Leone, because these guys also, I'm using them again as an example of doing very careful pre-project research, and they looked really carefully into mobile phone ownership and usage. And actually, what mobile phones are used for most is audio-visual. People downloading little songs and deleting them, people downloading and sharing them around. And the particular context that this intervention came in was health-related. These community health volunteers walking around with their big flip charts were increasingly being the subject of aggression, often violent assaults and attacks from Boko Haram militants, who were at the same time spreading rumours that the polio vaccinations were a method of sabotage. The US were taking samples of blood from Nigerian children, and it was all part of a big means. So UNICEF were wondering how to counter this messaging and how to protect their community health volunteers, and sharing flip charts through Bluetooth was the innovation that they came up with. So this works, and again it's slightly different from the media ecology in Sierra Leone, because lots of people in Nigeria own very simple phones, but 83% own the tiny little brick phones, even 90s phones I think, which can have a colour picture. That's kind of all you need, and sound on the top. So UNICEF digitised flip books to have these simple pictures, and I think they're about a minute long, and so you see a few pictures, and there's a voiceover of a popular radio voice who everyone loves, and it's wonderfully simple, and it was also the method that Boko Haram were using. They were sharing videos via Bluetooth. So UNICEF turned this ICT channel that was being used for terrorism into a health intervention, and the way it explodes through this spiderweb effect is fantastic. The volunteer health worker shares it with one household, who shares it with three others, who shares it with three others. And because of the novelty and the interest, there's huge demand, and people are coming back saying, yeah, we want more, we want more. And they can really target as well special occasions like a naming ceremony or a wedding. Somebody just goes to the edge of the crowd, shares with their Bluetooth, and it goes off. And key elements of this, which are also part of working out your people before you choose your platform, are that Bluetooth doesn't need to be online. You don't need to have phone credit. You need to have power, and as you said, of course that's an issue. But that really is all you need: a very simple phone and power. You don't need the other two components. So it's not excluding people from a health intervention. Now I wanted to, actually I'll go back to this slide, because I wanted to go slightly beyond the binaries of rural and urban and male and female, to pick up a key element of this, which was privacy and anonymity, because showing yourself as a health worker was being a problem.
Yeah.
And even showing yourself accessing health services becomes particularly important in HIV and AIDS, where research has shown that there's a huge people who are very insecure about openly getting information about HIV and AIDS for themselves. So this needs to be really carefully thought through in your use of ICTs, which was a key lesson we learned in the project, as was done in Nigeria. So I wanted to think a bit, or we thought a bit in the report about space and the platform in which you're meeting people. So the Nigeria example is in person to person, but some other examples, this is a video game. So this is either done by yourself or particularly should be done in a group. It's called Pajoma Mutani, and it's been, Pamoja Mutani, and it's been launched in Kenya. About 4,000 people were playing it in the first few months. And it's available for private use, but also in gaming centres. And there's 5 different characters. You can be a musician, a techie, a doctor, a tout, and something else. I can't remember the other one. And the game is quite simple. You're running around a town and you have to help. There are some stolen items which you have to get back. And there are a number of side games. But throughout, you have to make a few choices, and your decisions will impact whether you're more at risk or less at risk of getting AIDS or getting HIV, and also certain decisions you make can help other people as well. So the way that this platform is approaching its audience is within a private space and within quite an intimate space within friends. And that's a very important way of introducing the messages to people. Similarly, Standout 22285, which isn't the most concise name, is a tech service which is used by Family Health Option Kenya, FHOK. And this was actually perhaps something that would work in Sierra Leone as well, although it does require literacy. It's a message sent to your phone, and it's a free text messaging service, and you follow kind of number menus and you get different information. So this is using ICTs to greet people within a fun gaming space and give them messages. And this is an example of giving people messages on demand. But both of them are using a private space, and crucially, through this private space, bridging to in-person healthcare, because that was what we found was really key. The most effective ICT interventions were the one that were linking with in-person healthcare and were proving that they were increasing attendance at clinics and getting people to go and see people. Here's an example of another case study. Just love this picture. This is from Freedom HIV and AIDS, which used sports games on phones. So building on the popularity of football and cricket, and there was even a fighter pilot one where you have to drop condoms on different villages. But again, it's a way of getting messages to people, to young people through a platform that they really want to engage with. And I should have said, thinking again about platforms and people, this game had young women in their design process. It was designed by Warner Brothers in partnership with USAID. So a great example of a private-public partnership creating something of very high quality. Higher quality than the video we saw previously, I would dare to say, which was just done by a UN agency, but this one with Warner Brothers' weight behind it created something really complex and expensive and sellable. But yeah, young women were in the design process and helped to make the situations close to them. Still, there's a question, and they're seeing reticence for young women to play the game because it's less of it's more of a boys' world, sitting with your controllers. But yeah.
Can I ask quickly? Do people choose to play a game which explicitly has a health message? Or are you coming onto that?
No,
or do they? Or is it sort of a game which is just a good game plus it has health messages?
Well, I could actually show you the trailer. I wouldn't have said it, so thanks for asking. Pamoja Mutani, when you watch the trailer, you'd have no idea it's a health game at all. So it doesn't make it explicit in any of its advertising, really. There's some little USAID branding on there. But I think you're right, they're specifically steering away from branding it as a health game and just sewing it into the fabric of the game itself. So this is fun, messages getting to people in a private space through a platform. But when this was set up, Freedom HIV/AIDS had no monitoring and evaluation platform in at all. And since then, they have introduced some monitoring and evaluation, but it brings you on to the third grouping of the lessons learned, which is, are these healthy interventions? Who's checking the pulse on the interventions? What's their life expectancy? Because Freedom HIV with this phone game didn't have a monitoring and evaluation, it's been really difficult since to state its impact. Even though they've had one now more recently, when you don't have monitoring and evaluation from the start, it's very difficult. So I've got this slide up. This is Femina Hip, who have some great case studies in the report, which is available online, I should say. It's on our website, so you can read the whole thing through. Femina Hip responded to their urban audience. They largely work through magazines, which are distributed around the country, but also have this great Facebook site, which they started in 2010 to meet a need there. Lots of people are on it, lots of discussion, and with lots of these new social media platforms, data is so readily available. Just me, as a user last night, I could go on and see their analytics, which are just on their site, that's not hidden. And so, wow, maybe we've got this amazing opportunity moving into ICTs to get lots of information. But it's a lot more complex than that, and a lesson learned from the report is that there have to be very careful platforms to gather data, particularly because of the sensitivity of lots of young people with HIV and AIDS or asking questions. That data has to be very carefully stored. Anonymity is really important with sending messages. And so here, nearly 15,000 people have liked this page, but what does a like really mean? We know with lots of young people today, a like is almost, I've seen the page. It's no processing of information or really meaningful engagement, and let alone stimulating any behaviour change or service uptake. So an intervention which we found to have done considerably better on the M&E was Smart Care, which is used by Family Health Options Kenya. So this is the phone game, which has since redeemed itself. And this is quite a complex platform, which was actually developed by the Ministry of Health in Zambia. I'm sorry, it's unclear. But it gathers and synthesizes all of the data which is being sent from FHOK to their users. It disaggregates it by gender. It can tell what messages were responded to, which clinics were advertised, and compare that to clinic uptake. So you'd think this kind of stuff comes naturally with using some of these ICTs, but we found that it really doesn't, and checking the pulse of the intervention is really, really important. So what next? It seems like ICTs are a space of really fun, funky innovation. There's lots of creativity. Things are moving fast, and they have the potential to really take off and transform the communications landscape with young people. But we definitely need to have a stronger community of practice, because lots of these interventions, once the software has been developed, could be shared without a huge amount of cost in other contexts, but there needs to be more communication about what's going on. Similarly, a community of practice to build these M&E structures and improve these platforms so that more and more people can use them. So maybe the C4D Network is a good place for that, and over this next quarter we'll try and talk more. We'll keep ICTs relevant in the conversation. There's also a great platform we've become part of, which is Young People and HIV, which is a very vibrant discussion space.
And we'd really like to encourage you to engage with that one, because they're needing people to engage more with it and to kind of ignite it a little bit. So we'll try and help them do that.
Yeah, so that's it. I know I've whizzed through a number, and there are actually some other great platforms on there which I haven't had time to talk about, but do ask any questions.
Thank you. Question, the floor is open. Would you like to go first?
Sure. Thank you, that was really interesting. I just have one quick question around, which you kind of touched on at the end, but I'm interested in your thoughts a little bit more on it, which is around this sort of impact piece. So there's these really interesting technological innovations that are happening, but to what extent are people actually better understanding drivers of behavior change as a result of these interventions?
I think my emphasizing privacy and anonymity was one of the elements of behavior change that people have really found, that the successful interventions were the ones that used anonymity and removed that barrier, which is feeling threatened or shamed by going to access information or services. So making that more, so that was seen to be a barrier and a determinant of their behaviour. Other than that, you're right, there does need to be more research, and I'm not sure that the development of these ICTs is really contributing huge amounts to behaviour change understanding, because often these projects come opportunistically, and they're built off a real excitement for a new platform, and they will certainly research their target audience, but in terms of a more holistic understanding of the issue, it's probably, my feeling is that it's not coming from this community exactly. Maybe it's more from research, people who are more explicitly researching rather than people who are implementing projects and doing the research related to that platform. Maybe, I'm not sure.
Questions from the floor, from the